What might be the motivation for an LGBT person seeking therapy or counseling?
Well, the people that were involved in my study were able to identify that they wanted to pursue traditional marriage, and their same-sex attraction and lack of opposite-sex attraction was getting in the way of that. And then there was another large group that wanted to pursue sexual attraction fluidity, wanted to explore their potential for heterosexual attraction because they wanted to be congruent with their religious beliefs. They wanted to live according to their faith.
What does scientific research say about the effectiveness of SOCE therapies? How many out of 10 patients will have a heterosexual orientation?
You know, we don't have that kind of, I haven't seen that kind of data, you know, that equivocally says, or unequivocally says, that there are certain percentage that change. We don't have that kind of quality of therapy. I mean, of research on the therapy. We have, you know, some kind of qualitative research that tells us that a lot of people do experience change. Other people don't. But I don't know if there's a percentage available. I don't know about it.
According to the opposing side, SOCE therapies have harmful effects on patients, such as increased feelings of shame and suicidal tendencies. Are the allegations true?
So in our study, well, let me give a background first. The research that has exposed that are people. There are definitely people who are harmed in any kind of psychotherapy, regardless of what the goals of the client are. We know that around 5 to 6% of people experience harm in psychotherapy for any presenting problem, depression, anxiety, so forth. So yes, there are going to be people who experience harm in any kind of situation. But what the research that has concluded that people are harmed with this are they've only recruited people who experience the harm to do the research with. So they post experience of the therapy, they recruit these folks who say, yes, I was harmed. In fact, one of the studies put up posters everywhere that said, please help us document the harm. Well, that's a biased recruiting effort. So there isn't any really great research to demonstrate that. In our study, what we found was that the people experienced reduction in suicidality, reduction in depression, reduction in anxiety, and an increased sense of well-being dramatically. In fact, they came in with clinical levels and left like a normal population would in terms of their distress. So, at least in my study, that is just not true.
What are the methods used in the therapies? Because the opposing side talks about electroshock and aversion therapies.
So, good therapy is good therapy. You know, there's some studies that are done. What kinds of therapies are used for this? You know, helping this population. The same therapies that are used for anything else. You know, there's cognitive behavioral therapy. I'm a narrative therapist. There are people who use psychodynamic approaches. In this particular study that I conducted, they used reintegrative therapy, which is a combination of mainstream approaches to therapy, focused on trauma reduction, shame reduction. We find that people who enter therapy with this approach being used have an immediate reduction in shame and an increase in well-being.
Is there a follow-up consultation and feedback after successful therapies?
Yeah, we did a post therapy, or at least at the end of 2 years, everyone did a questionnaire completed a questionnaire talking about their experiences in therapy. I don't have the details of the responses to that, except for their level of sexual attractions. That part was what I was mostly interested in. That was the question I was asking. Did their sexual attractions change? And so we have some good evidence that to a statistically significant degree, their sexual attractions were influenced. They increased their opposite sex attraction statistically significantly and decreased their same-sex attraction.
Did you experience any attacks on you because of your research in the US?
Sure. Yeah. I mean, it's hate mail, to that. And people who, they attack my character. They attack the kind of person I am. I shouldn't be allowed to teach at my Christian university because I'm a terrible person, because I believe that people should have autonomy and self-determination, I guess.